Hi, a very good evening to everyone. Namaste. Thank you for joining in with us today. I'm Dr. Ruhi and I have Siddarth with me.
Hello, everyone. Namaste, good evening, and wonderful to have all of you with us today.
So before we start, it will be wonderful to know what brings all of you to this webinar today. So you can type it in the chat, your health concerns that brings you to the webinar, or, if there's, you just wanted to learn and you've joined. So please let us know in the chat what brings you to the webinar. So we are waiting to know if you're here for any health concern, diabetes, autoimmunity, thyroid disorders. Okay, Savita says she has hypothyroidism. How about the others? Okay, thanks for sharing. Alkaji says she has autoimmune conditions. Sangeeta has an autoimmune disorder as well. So we will talk in detail about autoimmunity. We'll talk in detail about hypothyroidism as well. Is there any other health problem that you would like to know about?
Yes, Neha is saying her husband has diabetes, thyroid, and a fatty liver. Anisha has psoriasis, cervical issues. Okay. We will talk about diabetes, etc. as well. We'll also talk about liver. What
Okay.
about the others?
And have you all, for all of those who have, shared with us your health concerns, are you also on medications for these? Okay. I'm sure the people who are here for thyroid disorders are, you would be on thyroid pills. Okay, I also see for autoimmunity, you're on steroids, Ayurvedic medicines, steroids. Okay, yes, HCQs. So largely, most of the concerns, in fact, all the concerns that's been shared by each one of you here, these are all chronic conditions, and you are on, either immunosuppressants or pills for symptomatic relief for the same. As long as you take the pills, you may find some relief, but and not in all the cases you find relief. You may be on pills because that's what you have been told to do, and it's pills for life. Whether it gives you any relief or not, it doesn't really matter, but then you're just on those pills because you've been asked to do that. So we'll start today's webinar, and I hope by the end of the webinar, each one of you who are here will have various takeaways and also have a better understanding of the diseases with which you are struggling. So for the next 1.5 hours, I request all of you to be focused here, so that you are able to really understand what is going on with your body, when you're struggling with a chronic disease like what you've just mentioned. So I'll share my screen. All right. So in today's webinar, in the next over the next 1.5 hours, we will talk in detail about autoimmunity, about thyroid disorders, gut health, obesity, diabetes, PCOS, and other hormonal imbalances which have become so rampant today. While we talk about all these conditions, we will also be talking about a root cause based approach, which is a functional medicine based approach to address all these chronic problems. We've been working with uh, many, many, many patients for now, and we have been able to provide a good um, recovery to people who have come to us, and we will be sharing a lot more in today's webinar. So I'm Dr. Ruhi Agarwala. I was trained as a medical doctor. When I didn't find satisfaction in what I was really doing, and I wanted to switch, and I didn't want to continue doing, practice allopathic medicine throughout my life. That's when I chose to switch my career and move to the preventive side of health. And I started, and I trained myself as a public health specialist. But even after my training in public health, having learned about preventive health, the real root cause of diseases was still unknown. And that quest for knowledge made me further pursue functional medicine, where I could find answers to so many questions, that um, I wanted to know about all this while. And in the last 3-4 years, I've worked with all kind of conditions, all kind of chronic conditions, be it autoimmunity, gut health, metabolic dysfunction, women health. And it's really satisfying to see the kind of difference we have been able to make in people's life. So that's about me. Siddarth, over to you.
Thank you. Good evening. Namaste to everyone. So, as the slide says, I'm a health coach, educator, yogi, speaker. So, my journey has been interesting in the sense that I didn't study medicine after my school, but I had a very strong interest in the field. And when I had some health issues, which actually were created by the medical system largely, I did not find any solutions in the conventional system of medicine. I tried various types of therapies, etc. And then that is when I kind of discovered, fortunately, I discovered functional medicine, stu- studied the science, and I was able to, largely heal myself. So that experience kind of, motivated me or pushed me in the direction of using this knowledge to help more and more people in the world. So I've worked with a few hundred people. Most of them have come by word of mouth. And a few years back, um, what I realized was that one segment of our population, which is women, they struggle with a lot of health problems, and for a variety of reasons, very often they will not even seek enough, support, whether medical treatment or otherwise. And this is especially true for their hormones related issues, the reproductive hormones. And increasingly now, what we are realizing is that autoimmunity is increasing very rapidly in the society, and more women are affected by autoimmunity than men. And that is when we came together to create this program, myself and Dr. Ruhi, where we felt that the whole thing that we are offering becomes much more effective and efficient when we are able to offer it as a group program instead of just a one-on-one treatment process. So that was the genesis of this program. We have helped a few hundred, I think, maybe close to 1,000 women now, recover their health. That's all. You will hear from me more later. Over to you, Dr. Thank you.
Thank you. Okay. So Before we dive into the facts, let's break some most common myth. The first one, that every woman will agree with me here, that, you're going through period pain, cramps, mood swings, acne, breakouts, and all of these are just considered normal. Anybody here who agrees with me here? It's normal to have pain. No, it's normal to have the cramp, or anybody who does not here. So is it normal to have period pains, mood swings every month? Right, Kalpana, it's not normal. So just because everybody around you is facing this, you are made to believe it's normal. But the truth is, whether it's period pain, cramps, mood swings, it should not be there, during before your periods or during your periods. Your period should be as normal as any other physiological process in your body. If you're undergoing all these symptoms, it's a sign your body is giving that something is off. Your hormones are off and you need to fix them. And when it comes to any hormonal issue, most of the time, the solution is a hormone pill, whether it's PCOS, whether it's uterine fibroids, whether it's a breast lump. In most of these cases, it's a hormone pill, which is the solution that is offered. So that's another most common myth. If there's a hormonal imbalance, just fix it with a hormonal pill. Well, again, that's just a band-aid fix to all your health problems. And it's generally, considered that your period problem, it's just different from the rest of the body. It's not connected with your body. But again, your period problem is so much connected to what's happening in your gut, what's happening in your liver, what's happening in the rest of your body. So you cannot just consider any health problem in isolation. Our body is a smart connected system. So we will have to look at every health problem in connection with the entire body. When it comes to thyroid disorders, the solution is a thyroid pill. And once the diagnosis is done, it's a thyroid pill for life. Well, again, a thyroid pill will not fix your hypothyroidism. It's a band-aid fix. Initially, you may feel good because your symptoms are just slightly managed with it. But over a period of time, there is just a stagnation. You will not see any difference. Whether you take it or not, it's the same. You may be happy because your TSH is in range. But again, you're not treating your TSH levels. You need to treat your body. And with a thyroid pill, you won't be able to treat your body because you're still overlooking the fact that what really is contributing to your hypothyroidism. Why has your thyroid gland already all of a sudden decide not to function well? And for all those of you who are trying to lose weight, another biggest myth that is often heard is you eat less and you work out more and you will be able to lose weight. Well, this mathematics does not unfortunately work. There is so much going on in our body at the cellular level, at the mitochondrial level, that whatever you eat is not necessarily absorbed by your body. So just eating less, and you work out more and you think, okay, calorie in, calorie out, and it will work. No, sorry, this will not work. If you're putting on weight, it's a sign of underlying inflammation. Your body is saying something is not okay and you need to take charge. So Savita here says she's been taking the thyroid pill from last 12 years, but of no use. So exactly, Savita, that's where we are coming to. It's like, the thyroid pill has become your friend for life and you're just taking it, but just because you're told to do that. And lastly, for all of you who are here with an autoimmune condition, the myth around this is that autoimmune disorders are incurable genetic diseases which require a lifetime of medications. Now, most of the time, whenever a diagnosis of autoimmunity is made to an individual, the person is just, breaking his or her head trying to figure out who in my family has this, this autoimmune condition, and probably will not be able to figure out anyone who has, an autoimmune condition in their family. But still, you are told it's a genetic condition and you're on immunosuppressants, steroids, or some medications for life. The quality of life goes down with every passing day. And the whole fact that, you're told that autoimmune, the condition that you have, you cannot do anything about it. You just have to live with it. That can be very demotivating as well. But we will understand more and break the myth around autoimmune conditions, that where is this autoimmune condition coming from, you know, and what can we do about it to get it fixed and start reversing this. So yes, autoimmune conditions are not incurable, and they are not uh, just genetic diseases. So while we spoke about all the myth, now the symptoms that you see here, right? Hormonal imbalances, chronic headaches, chronic fatigue. You've put on weight, or either you've lost weight. Your skin is just, flaring up with all kind of issues. You're not able to think clearly. You feel like you have a brain fog. You feel fatigued all the time. Congestion, sinus, anxiety. You're not able to sleep well. So, how many of you are struggling with these diseases? You may not necessarily have any diagnosis, but yeah, can you say that, yes, I have at least five of the symptoms that's there on the screen right now? Savita says, yes, she has. Yashita also has. Okay, just one or two. Right. Manisha says psoriasis flares, weight gain. Now here, the symptoms that's there on the screen, they've just become so common, right? Insomnia has become so common. You're trying to sleep and you're not able to sleep. And, the gut health has just gone for a toss. You're having frequent infections. It can be, respiratory infections, or it can be UTI. You just feel tired all the while. You're just in your 30s and you already feel like, you're like in your 50s. That stubborn weight gain, you're not just able to lose. Yes, Aarti, anxiety attacks. Many people will relate with anxiety attacks, and you have no clue why you're having these anxiety attacks. The skin has just decided to flare up all the time, and you're not able to figure out what is going on. Why is your skin behaving like this? You never reacted to certain food, and all of a sudden you're reacting to every food that you're eating. Well, all these didn't happen all of a sudden. There was a gestation period, and all of this has to do with the kind of choices we made on a daily basis, the choices that we made for ourselves, on our body. That has, over a period of time, resulted, in the manifestation of all these symptoms. So I'm sure each one of you would, who are struggling with any of those symptoms, you would definitely want to, find liberation from those symptoms, lose the weight that you've been trying to do, have pain-free joints, better sleep, no puffiness when you wake up in the morning, reduction in your hair loss, better sleep, pleasant emotions, and a lot more of these, better GI system. And all of these is achievable if we start understanding what really is causing all these problems. So if you are struggling with 5 or 10 different symptoms, you cannot really treat each symptom separately. So it's time to change the approach that it's being taken. We need to stop treating each symptom. Imagine if you have to treat 10 symptoms in your body and you need 10 different pills for that. That's not practical, right? So we really have to stop looking at each symptom separately, and just taking a pill is not the solution. We need to take a step back and understand, identify the root causes and fix them. So Noora is saying, is it always our lifestyle or does genetics play a role? Well, Noora will come to that. It's both lifestyle and a small role is played by the genetics. And this entire science is called epigenetics. So you may have a certain gene which is prone, which can put you at risk of a certain disease. But what your lifestyle, your food, your environment plays an important role. And not, if all of these are bad, those genes will manifest. So let's pick up, conditions one at a time and understand what's really going on with, what are the main drivers of those health problems. Let's start with hormonal imbalance. So there are two main drivers of hormonal imbalance. One is insulin resistance. So how many of you know about insulin resistance? Anyone who knows what is insulin resistance? Okay, great. Vidya says yes. Most of the time, insulin is connected with diabetes. People people know insulin because, yeah, it causes diabetes, but it's not just about diabetes. Insulin is a very important hormone when it comes to metabolic function, it comes to hormonal balance. And insulin resistance means your body is, that insulin that you have, it's not working, it's not doing its job. And that's why the body keeps pumping, the pancreas keeps pumping a lot of insulin so that, it starts working. But apparently, it has just decided not to work. So your insulin is not working and you have high levels of insulin in the blood. And why is your insulin resistant now? Well, it has to do with all the refined carbohydrates that you've been taking. It has to do with your choice of not moving your body, the toxins in the body, the deficiencies, the nutrient deficiencies, and the chronic state that one is in all the time, right? All these are contributing factors which basically make the insulin not to work. And again, all these factors make the engine of your cell, the mitochondria, shut down. And when the mitochondria, which is the powerhouse of the cell, shuts down, the insulin is not able to do its job. So time to look back and see, Sri Devi, you say you're a diabetic. Well, it's time to see which of these 4 or 5 factors, refined carbs, sedentary lifestyle, toxins, deficiencies, chronic stress, are playing a role in your body. So insulin resistance does not just play a role in diabetes, but also in hormonal imbalance. So women who are struggling with PCOS, women who are struggling to lose weight, women who have become diabetic, all of them will have insulin resistance. And this insulin resistance eventually leads to hormonal imbalance, and I'll talk about that in the next slide. The second most important driver of hormonal imbalance is the endocrine disruption caused by estrogen dominance. Now, estrogen is a very important hormone for for our body, but after its work is over, it should be removed from the system. When your liver is too busy doing other work, when your gut health is not good, that's when estrogen will start accumulating in your body. And too much of anything is not good. And when it starts accumulating, it will disrupt your hormonal system. And this causes all the symptoms that you have during your periods, the pain, the cramps. It causes the premenstrual symptom as well. Just before your periods, you have, breast tenderness, you have bloating, you have swelling in your body, you have cramps. All that is because of estrogen dominance. Now, I talked about insulin resistance, high level of insulin in the blood. Now, what is that? What does that have to do with your hormones? Well, high insulin levels will make now imagine insulin is pushing glucose into the cell. Insulin is not working now. Where will all that glucose go? So sugar go. That will start converting into fat, and now this fat has to deposit somewhere. So it will start depositing in your liver. It will start depositing in your belly, on your face, on the back of your body. That's the stubborn weight you're finding it difficult to lose. So right with you, you're right. All this fat starts depositing in your liver. You get a fatty liver, and you just wonder, I never had alcohol. How on the earth, you have a fatty liver? Well, it's because of high insulin levels in your blood. More fat deposition means more conversion to estrogen hormone, and hence you will have more estrogen dominance. And again, more high levels of insulin also will promote more conversion of the male hormone. And when you have more male hormone, it causes acne. You start losing hair thinning happens. Women start growing hair on their face, on the other parts of the body, on unwanted parts of the body, hirsutism. So that's typical of high insulin levels. So that is how high insulin is messing up with your hormone. How is estrogen dominance causing you the symptoms? Well, estrogen dominance is causing uterine fibroids, PMS, heavy periods, painful periods, fibrocystic disease in the breast lumps. There are ovary because of estrogen dominance, endometriosis. So all these are because of estrogen dominance. Now, if you're just treating all of these with a pill without understanding where is estrogen dominance coming from, you may be able to somehow mask the symptom of hormone imbalance somewhere, but then the underlying imbalances will start contributing to diseases somewhere else as well. So a hormonal pill for estrogen dominance is not the solution. We need to see why you're estrogen dominant. Is your liver unhealthy? Is your gut unhealthy? Yes, Vidya, that's right. We are not told, why one has estrogen dominance and one is just put on pills. So, there are a couple of people here who have mentioned about autoimmunity. Falak, I am suffering with lichen planus. Yes, that's again an autoimmune condition where fungal infections have a very important role to play. Uma says, does the uterine fibrosis caused by hormonal imbalances? Yes, it's caused by hormonal imbalances. And I just showed now that it's caused by estrogen dominance. And again, estrogen dominance is caused by multiple other factors. Well, autoimmune diseases, the process is autoimmunity. Now, this autoimmunity, when it affects your thyroid gland, it's called Graves' disease. It's called Hashimoto. When it affects your joints, it's called rheumatoid. When it's affect your skin, it's called psoriasis or lupus. When it affects your intestine, it's called the celiac. So based on which organ of the body it is affecting, it gets a name. But again, the bottom line is there is an autoimmune process which has started in your body. And once it has started, it will not differentiate. Okay, I started in thyroid, I should only focus on thyroid. No, the autoimmune process will not be so careful and, organ focused. It will start involving other organs as well. There are multiple cases who have come to us where it all started with Hashimoto, and then, they were just taking pills, doing nothing about the autoimmunity, and then it started, then it involved the skin and caused psoriasis, then rheumatoid, then lupus. So it's very important to understand why autoimmunity has come. When we look at the conventional thought process, it is considered incurable. Once you have it, you have to live with it. It's a genetic disease and you require a lifetime of medications. In functional medicine, we look at it from a root cause based approach. Now, what you're doing to your body, your environmental factors, such as the kind of situation you are in, chronic stress, the kind of infections that's there in your body, the kind of medications you're taking, the kind of hormonal balance you have, the toxins you're exposed to, all these together, they can trigger autoimmunity in an individual. And especially when an individual already is genetically susceptible, the chances are even higher. So that's called epigenetics, right? The genes can be turned on or turned off by the kind of environment you're giving to your body. So you may have inherited the best genes, but then the environment you've given to your body is bad. The best genes are of no use. They will shut off. So they will not manifest. Disease will creep in. So if we can understand what is really contributing to disease in your body, what is contributing to autoimmunity, it can be corrected and reversed. So let's dive deeper into the most common root causes that is behind hormonal imbalances, that is behind thyroid disorders, behind autoimmunity, behind metabolic dysfunction, or be it any other chronic disease. The first and the foremost is what you're putting in your body. So your diet. Now, most of the time we see the diet of people today is high in refined carbs. It's loaded with white rice. It's loaded with refined flour. There is processed sugar in the diet. Now, imagine if that is the kind of diet an individual is taking, it immediately converts into sugar, and this sugar feeds infection. This sugar causes insulin resistance. And there are multiple other things it contributes to, but that's the kind of diet, that's on everybody's plate today, and most of the people. The consumption of processed food is high, whole grains are less. And usually the kind of oils used in cooking is refined oils or seed oils. When I talk about seed oils, I'm referring to groundnut, sesame, mustard oil. Now, when there is high inflammation in the body, it's not a good idea to load yourself with omega-6 because there's already an imbalance. And hence, if with someone who's struggling with a chronic health problem, the seed oils are not a good idea because it will just add more inflammation to your body. The diet hardly has any, antioxidant rich veggies or fruits. It's mostly cooked food all the time. So where will you get the nutrition from? The soil is already depleted of nutrition. And then on top of that, if you're hardly including, veggies and fruits, you're just depriving your body of nutrition. The water that we drink today is largely dead water, and which means the water does not have any structure. So when the water does not have any structure, it does not hydrate your cells. Your blood reports will show that you are dehydrated, and chronic dehydration can cause migraine. It can cause metabolic dysfunction. It can contribute to autoimmunity. So it's very important that you drink the right quality of water and structured water. For those of you who take dairy products, meat products, the conventionally raised dairy and meat products are loaded in antibiotics. They're loaded with hormones, and when we consume them, they are toxin for us. They are messing up our hormones. Um, and that's why today we also see that young girls are having early menarche. And what's the reason behind it? The reason is the hormones that is that is pumped into their body through dairy and meat products. So I'll while I go to the next, so what I'll take up one or two questions. So Vijay is asking, what is structured water? So, Vijay, that's structured water is the kind of water we should be drinking to hydrate ourselves. And the water that we drink today is coming from RO water, which basically is dead water. It may be filtered. Uh, yes, we need filtered water. Otherwise, the water is passing through different layers and we don't know what is being added to the water. So yes, water has to be filtered, but then it shouldn't be dead water. So the way to structure the water is the simplest way is you put it in sun for 3 hours and 3 hours direct sunlight, and that structures the water. And other way is having ionizers. So you attach an ionizer to your filter, and that will structure the water. Okay, so now what we are putting in our body as a food is one thing, but what our body is exposed to is one another big thing. So that is the toxin load, right? Toxin that is getting into our body through water. If you are drinking unfiltered water, toxins are coming to your body. Our skin is a very large organ, so anything that we are putting on our skin, right, it's getting absorbed in our body. And so this can be your personal care products, this can be your beauty products, all the cleaning products you're using in your house. If you check the ingredient, they're loaded with various chemicals which are unwanted for our body. Plastics, if you're still storing food water in plastic bottles, plastic packages, it's leaching microplastic, which is again going into your body through the process of food. If you are chronically stressed all the time, your body will not focus on metabolism. Your body will not focus on detoxification, as a result of which your detoxification pathways will be blocked. And when your detoxification pathways are blocked, you will just accumulate a lot of toxins. And as I mentioned earlier, the dairy and the meat products are all sources of toxins in the form of hormones, in the form of antibiotics. If your gut health is not good, again, the toxins will be just reabsorbed again. And imagine if you're chronically constipated, you're just accumulating toxins in your body. And of course, synthetic hormones are again, it's not natural for our body. And too much of this will just contribute to toxin load in our body in the form of estrogen dominance. So we need to identify all these toxins and remove them from our environment, from our body. Now, well, toxins you've identified the food, but then if your liver is not healthy, poor liver does a lot of job. So any medication you are taking, the liver will have to clear it up, metabolize it. Any toxins that come in your body, any infections that come in your body, all of that will be cleared up by the liver. So if your liver is not healthy, your liver is not producing enough bile, your digestion will be impaired. Your the bile also has antimicrobial activities, so it removes the harmful bacteria from your system. It also acts as hormones. It has so many functions to do. But if the liver health is impaired due to XYZ reasons, a lot of your health problems will creep in. Your detoxification will be impaired, your metabolism will be impaired, your digestion will be impaired, right? Infections will not be able to clear up from the system, hormone imbalance will creep in. So it's very important to identify if your liver is healthy. Another very important root cause of chronic diseases is poor gut health. We call our gut the second brain. It is a storehouse of so many microorganism, bacteria, virus, fungus, and all of these live in harmony, contributing to a good environment in our body. They secrete enzymes, they secrete hormones, they secrete neurotransmitters for brain function. That's why, if someone has depression, has anxiety, it has to do with their gut health. The gut health is not making that those neurotransmitters which work on the mind, on the brain. Second, autoimmunity has a big connection with gut health because all your new immune cells, they're trained by the gut microbiota. But imagine when your gut health is not healthy, you feel bloated, you're not able to digest food, you have a sensitive stomach. All this means your gut microbiota is also messed up. They are not healthy. Pathogens are thriving. And when your gut microbiota is not healthy, who will train the new immune cells which are being released from the bone marrow? And then these immune cells just go haywire. The immune system is not trained well, and it just is not able to differentiate between whom to fight, whom to protect. And that's one another main reason of autoimmunity. So if we have to address autoimmunity, if we have to address certain chronic problems, we need to look at the gut health, um, identify the infections. If there is a leaky gut, if your gut has leakage, right? The tight junctions are loose. We have to fix them because otherwise the toxins, the pathogens are all finding their way into your body and contributing to a systemic inflammation. So what is happening in your gut is not staying in the gut. It is coming from your gut to the entire part of the body. In many cases, many of you would have experienced that you've just eaten certain food and your pain in your joints gets aggravated. That is because the food that you've eaten is not getting digested. It's converted to pro-inflammatory compounds, and that pro-inflammatory compound is now causing inflammation. The second way is, again, it's contributing to leaky gut and it is causing systemic inflammation because of which you're having pain. So it's very important to identify a leaky gut and fix it. Identify allergies and fix them, because if you're allergic or sensitive to certain food and you just keep taking them, you are putting your immune system, on fire. Your immune system will start attacking those food, and while it does that, it will start attacking your body tissues as well. So look for low stomach acid if you're not able to digest food. You need to identify whether you're low on stomach acid, you're low on digestive juices, so that you can address these situations. And of course, if you're chronically constipated, it has to be resolved very soon, because then you're just loading your body with toxins. You're just creating an unhealthy environment where the pathogens will thrive. So Vidya is asking how to check gut health on basis of symptoms. Well, there are some very detailed investigations that can be done. So where we can look at the fungal infections, we can look at the parasites, we can look at bacterial infections that can be at play, we can look at the metabolites, and that can help us understand if what kind of infections are there in your body. Now, infections, toxins, nutrient deficiencies, all these, what are they eventually doing to our body? Well, how many of you have, how many of you know about mitochondria? Have you heard of mitochondria? Yes, in the school. Well, I remember as a child, in science, we would draw, right, in biology, when we would draw cells, we would make mitochondria as a kidney-shaped structure, and it's a powerhouse of the cell. So, which means it will process everything and it will make energy. Now, if your body has infections, if your body has toxins, you do not have the right nutrition, then all this will impair the mitochondrial function. So basically, just like a car runs on an engine, our body runs on mitochondria. If your mitochondria is unhealthy because of all the reasons that I've listed, it will not be able to produce the energy. It will not be able to process what you're giving to your body. And when the powerhouse is shut down, your body will not function. It gets prone to diseases. Well, Megha, you're saying I'm not audible. Am I audible to the others?
Yes, you are.
Okay, all right. So Megha, you may want to check your uh, connection. So it's very important to look how good is your mitochondrial function. And yeah, infections, toxins, very important, blue light toxicity. Well, what is blue light toxicity? The artificial light that each one is exposed to is blue light toxicity. The light that the artificial light from the laptop, from the mobile phone, from any kind of screen, from the white lights. If you see, I am sitting in yellow light, and so that I can protect myself from blue light toxicity. So all this blue light toxicity damages mitochondrial function. It is also a cause of chronic migraines in people. It's a cause of metabolic dysfunction. So it's important to protect your body from blue light toxicity to protect your mitochondrial function. And again, good quality of water is important for mitochondrial function. Certain nutrients are important for mitochondrial function. And if your body is chronically deficient on this, you will also you are then just prone to chronic diseases. And especially if this is how you are before sleep, just checking your phones or spending time on laptop, it's not good for our body. Our cells need time to repair and regenerate. So if this is what your everyday routine is, that you're spending a lot of time on the phone before sleep, your cells are confused. If you are giving your cell body too much of light before sleep, your cells are getting confused whether it's daytime, whether it's nighttime, whether they should repair themselves or not. So basically, there is a circadian mismatch. So it's important you identify these situations and correct them accordingly. And most important, chronic stress. How many of you agree that you are in chronic stress most of the time? Or you're not stressed at all? Right. Vidya, Nusrat, you agree that you are in a chronic stress, because today even a small thing becomes very stressful, right? That's how our body has become, or I would say the way we look at a situation has become, that uh, even a small simple situation which may not be otherwise so dramatic or so stressful, but it just becomes a stressful situation for us. And when your body is in a stressful situation, it does not care about metabolism, it does not care about reproduction, it does not care about good gut health. Your body will just try to prepare you to fight that stressful situation, right? So everything is just shut off. So that's why you will see if you just try to look back, when your diagnosis for autoimmune condition was made, in most of the cases, we see there was a certain period of chronic stress, which led to, eventually genesis of a certain condition in the body. So when we look at the history, yes, 4 months back, my situation was very stressful, and after after a few months, I was diagnosed with this health problem. So it's a state of chronic stress which has just resulted in kind of the entire imbalance in the body. Yeah. So this is what most of you are in today. The body is not able to differentiate whether it's a tiger or whether it's just a stressful job that you are in. The body will just react the same for any stressful situation. It will just prepare you, and if you are in this situation, the entire day, the entire week, 365 days a year, well, that is just calling for ill health. Your body is not able to shift from the sympathetic mode to parasympathetic mode. You need to be in parasympathetic mode in majority of the time so that you can repair and regenerate. But today that's not happening. You are in the sympathetic mode all the time. So how many of you were able to connect with these root causes? Were you able to look back in your current situation and see that, yes, you need to correct this in your life? Okay. So Vidya says yes, Savita, Aarti. So when you're able to connect with these root causes, definitely, if you start correcting these root causes, recovery is possible. So Manisha, yes, I would love reset if all that's possible, and that's definitely possible. So we'll learn more about that. Over to you, Siddarth, now.
Thank you, Dr. Ruhi. These are incredibly complex topics, and you have a knack for explaining them in very easy to understand manner. So I hope I hope everybody is able to see my screen.
Yes.
Thank you. Okay, so I'll be talking about very simple things, okay? So I will say majority of you here, when we asked you what ailments are you struggling with, most of you are mentioning some or the other type of autoimmunity, right? So just let's look at it for a little while more, couple of minutes more. What are the different components that go into the making of an autoimmune disease? First thing is a leaky gut. What is a leaky gut? Again, it's a very technically complex topic, but please understand that the whole primary purpose of the intestine is to absorb digested food, right? So it has to be leaky. It has to allow the digested food to enter the body. But it has to be a very intelligent filter where it does not allow anything else to enter. Because your gut is a very, very messy place. It has food in all different stages of digestion and rotting and decaying also. See, when bacteria eat the food, that is called rotting and decaying, isn't it? So that's happening in the body even faster than it happens outside. Not only that, these bacteria are producing a lot of toxins, which are also there in the gut. So it's a very messy place. Now, when your intestines get damaged because of a variety of things, including allopathic medicines, other chemicals in our environment, overgrowth of bacteria, and so many other things, poor food choices, food allergies, sensitivities, right? When this gets damaged, it is no longer as intelligent of a filter. It allows things that should not have entered to enter the body. When these strange things start entering the body, your immune system gets the technical term is hypervigilant. It becomes very, very alert. It thinks that attack is happening on the body. Okay. And when attack is happening on the body, what should the immune system do? The immune system should start attacking those strange things. That is exactly what happens in autoimmunity. It becomes hyper aggressive. And when this process does not stop for months and years, right, then the immune system will get confused and also attacking it will start attacking some parts of your body as well. Dysbiosis. So the overgrowth of unfriendly bacterial species and fungal species, etc., in the gut is referred to as dysbiosis. There are literally trillions of bacteria who live in our gut. We talk about genetics. It is the genes that decide, who's going to be a human being, who's going to be a gorilla or a chimpanzee or whatever, right? So the bacterial DNA, it exceeds our DNA by 100 times. Okay, 100x more. So if they're wrong type of bacteria, they send the wrong kind of information to your body. Your immune system is in very, very close contact with the bacteria in the body. Okay. And just the fact that you have the wrong kind of bacteria will create an imbalance in your immune function. It's a very fundamental processes of autoimmunity. Why do we have wrong bacteria? Because first of all, we are no longer in touch with the source of good bacteria, which is soil, which is plant life, which is animal life, insects, nature, basically, right? We want to stay in a like a laboratory clean environment. That is not conducive for good health. Okay. And then toxicity. Dr. Ruhi has already spoken about this. There's so many different types of toxins in our environment. And many of those toxins have a direct impact on the functioning of your immune system, right? And yes, in this context, genetics can also play a role, but that role is never more than 10, 15, 20% at max, right? So there's this huge evolving field of science called epigenetics. What this is telling us is, genetics may load the gun, but you decide to pull the trigger or not based on your lifestyle choices. There are very famous cases. There's a very famous case of these are identical twins, sisters. Okay, so they have the same DNA. There is no difference, but they have very different lifestyle choices. One is, a party animal. Every weekend she has to go party and drink alcohol and smoke and everything else, all crappy food, fast food, processed food, and all of that. And the other one led a much more intelligent life, let me say that, in terms of health, right? Making the right food choices and not putting toxins into the body. By the time they're in their 40s or 50s, the first sister has a huge range of health issues. She is overweight, she is diabetic, she has a heart issue, and massive other problems. And the other one is absolutely fine, no chronic ailments at all. Right? So your genetics play a role in terms of predisposing you to a certain possibility of a certain ailment, but it doesn't give you the ailment, right? You get the ailment based on what the choices you make. And then nutritional deficiencies can play a big role. So for example, vitamin A, vitamin D, zinc, and omega-3, etc. These are, in functional medicine, they are known as immune nutrients. Okay, it's very important to have these nutrients in good level, not just above the reference range, but in a good level to ensure that your immune system functions well. So deficiencies can trigger autoimmunity. And then chronic stress, Dr. Ruhi was just talking about it in the previous slide. See, there's a huge amount of scientific evidence today, and we understand what is exactly happening in your body when you have stress in your mind. Okay, what changes happen? Which hormones go up? Which hormones go down? How does that impact your immune function? Everything today science understands. So this is no longer, just some kind of new age talk. This is hardcore science today. That chronic stress is the big elephant in the room. You may not have any of these other problems. Just chronic stress can screw up your health completely, right? So now if the problem is so multifactorial, and each of these names on your screen, okay, they are such complex topics that it's unbelievable how much time, effort, money has been spent already to understand these. And many of these topics we are still in the infancy, the initial stages of understanding them. When the situation is so complex, when the problem is comprised of so many different complex components, do you think just anti-inflammatory or immunosuppressive medication is the answer to autoimmunity? Or do you think you need to dig deeper and understand what is going wrong in the body, which is leading to immune function going out of balance, and address those? So you can put in the chat option 1, what is on your screen. Just anti-inflammatory or immunosuppressive medication is good enough. Option 2 is no, it is not enough. You need to dig deeper. So you can put 1 or 2 in the chat. Oh, sorry. So you see, I mean, all of you may not be, people who really study a lot of science or even understand science, but this is common sense, isn't it? When you look at this, it's obvious. This is the right thing to do. But how many have done it? How has anybody who's not well obviously has gone to a lot of, different systems of medicine, but very, very rare where, somebody will actually get the support to dig deeper in this direction, right? And that's exactly what functional medicine offers. Moving on to thyroid, let me give you a little bit of a bird's eye view into the complexity of the thyroid function. There are many factors, there are many parts to the process, right? First of all, you have to think of it like a small factory. If the factory has to produce the finished product, it must have enough raw material, right? So the raw material is on screen: nutrients, iron, iodine, tyrosine, zinc, so many vitamins, etc. If any of them, or if many of them are rock bottom or very low in supply, do you think the thyroid function will be optimal? Not happening, right? Then, apart from nutrients, there can be other factors which inhibit the production. For example, stress. The moment you have stress, your cortisol goes up, and cortisol has a direct impact on thyroid in reducing thyroid production. Okay. Various types of infections can do this. Trauma can do this, which means emotional, stuff that we're carrying from the past. Radiations, EMF exposure, Wi-Fi, telephone exposure, all these things. Certain medications. Fluoride in your toothpaste is poison for your thyroid. Both chloride, chlorine, and fluorine are poisons for your thyroid function. Many other toxins can have an impact on this, and obviously the autoimmune component is there, right? So many things can impact thyroid function. Now, I don't know how many of you know this, that 80% of the hormone produced by a thyroid gland is actually T4, and T4 is not active. It is the inactive form. It has to be converted into T3. And for converting, for this conversion to happen, you need a good amount of selenium and zinc to be available. Okay. Not only that, major part of this conversion for use in the entire body happens in your liver and your kidneys. If they're not in good health, if your liver is fatty, or it is inflamed, or it is filled with sludge, okay, it won't be able to do this job properly. And then when it comes to hormones, it is not just about how much hormone is being produced. Dr. Ruhi was explaining the concept of insulin resistance to you, right? Which essentially means how much hormone is enough to get the work done, in simple words, right? If your cells are not sensitive, then more hormone is required, right? So your cells, there are many factors which impact the sensitivity of your cells to the thyroid hormone, vitamin A, exercise, zinc, etc., right? And then there is something called reverse T3, which is a double whammy, okay, which makes the whole thing much worse. See, T4 should get converted into T3. Certain factors can increase conversion of T4 into reverse T3. Not only reverse T3 means less T3 is being produced, but reverse T3 will go and sit and block the receptors. So whatever T3 is there, it will not even be able to do its work. What are the factors that increase our T3 production? Stress, trauma, low calorie diet, trying to lose weight, right? By eating less and exercising more, inflammation, toxicity, infections, liver, kidney health, and certain types of medicines. Now, I think most of you, probably for the first time, even those of you who have a thyroid condition, would have understood the thyroid process in so much detail. So I have the same question for you. The tiny morning pill, is that enough? Is that enough to solve all these issues? Yes or no? Oops. What is happening? Definitely not, Manali is saying. Isn't it? But what is happening? How many of you have thyroid? I'm sure out of 60 people in the session right now, at least there will be 15, 20 who are struggling with thyroid issues, but everybody is just taking the pill, isn't it? You may be making some effort to eat better and this, that, but there's nobody really who's doing a full job of this. And unless you address all of those components, you have to identify and address those components. If you don't, you can't expect good recovery, isn't it? Monica, inflammation, okay, the simplest way to explain inflammation is suppose you just hit your hand on some object. Immediately there is swelling here, right? Why does swelling happen? Because when you hit the hand, many cells and tissues here got damaged. And the immune system has to repair that damage. To repair the damage, the immune system will have to create inflammation. So inflammation is a good thing. But when it becomes chronic, because there is damage happening all the time, right? Damage can happen because of poor food choices, because of stress, because of infections, because of nutritional deficiencies, and many other reasons, right? When damage is happening all the time, then inflammation will also happen all the time, and that is very, very bad for you. So, functional medicine is a approach of looking at the body as a whole and not saying that, okay, liver, fatty liver, let me just give you a pill to remove the fat from the liver, right? Functional medicine will always ask the question, what is going wrong because of which there is fat in the liver? What are the interconnections? What are the different functions and processes and organs in the body are involved with this, right? So you identify and address the underlying root cause of dysfunction. When you do that, you can actually address the cause of the problem. And when you do that, the body being a system which has tremendous ability to heal itself, it will start healing and repairing itself. And that is true healing. Okay, so we treat the whole body and not just the symptoms of disease. Does this make sense? Do you think this is the right approach for chronic health issues? Thank you for answering, lovely. So we offer the 12-week hormone reset program, which essentially, in simple words, is designed to address everything that we have discussed till now. Okay, whatever we find are the root causes for a given individual, we will work with them, help them to address those, right? It could be stress, it could be gut health issues, it could be emotional issues, it could be toxin related, or lack of exercise, or whatever else is relationship related, nutrition related, whatever issues, infections, etc. So if I have to give you, let's say, a bullet point list of what all we look at toxins and heavy metals, we look at chronic infections in the body, we look at deficiencies, we address inflammation, we work on gut health, we work on mitochondrial dysfunction, poor detoxification, we help you handle stress better, we'll help you learn how to do that, we educate you on EMF and other radiations and what you can do to start protecting yourself. And also on hydration. There's actually much more. This is all what we could fit in this slide. Okay. Now, if I have to briefly explain the process or the steps, this is how it goes. Once you register for the program, we do a thorough, detailed history taking. We understand, we take from you a lot of input in terms of current health issues and your health history. Based on this, we will tell you what tests you need to do. When you give us the test report, then based on your sign and symptoms and history and the test reports, we will do the root cause analysis and use that information to create a personalized treatment plan for you. The treatment plan will include all of these things and more, whatever we are discussing for the last 45 minutes or so, right? As part of this, there will be 2 one-on-one consultations also. And we will do a reassessment and realignment as needed for each individual. Okay. We teach meditation, a little bit of simple meditation and stress management techniques, how to calm yourself down so that your nervous system, only if it is in the parasympathetic mode, which is the relaxed mode, only then it focuses on healing the body. Otherwise, your brain, the nervous system is not interested in healing the body. So we teach you how you can stay in that state more and more of your time. We help you with techniques which can help you get rid of old emotional blocks which are still bothering you and also screwing up your physical body's health. We take you through a 3-day guided detox process. Apart from the 2 one-on-one consultations, there are also 12 interactive live group sessions. Okay. Each session we'll pick up one topic which is important for your health and we do a deep dive into the topic. And then we have some time, 20 minutes, half an hour at the end for question answers. Any type of doubts and all you have, you can ask. Okay. So throughout the program, there is real-time support and hand-holding available to you through the team, from our team. Whatever support you need or resources you need in terms of shopping list, handouts for various important topics, nourishing recipes, etc., all of that is available to you. Okay, so this is the program in a nutshell. So once you start on this journey, what changes can you expect? The first thing is you will start seeing your energy levels are improving. Okay. Things like headaches or this or that, those pains and aches in the bodies will go down, your sleep will improve, periods will start becoming more regular, skin will start gaining back the old glow that you probably had some time back. Okay. You will definitely be more in tune with your body. We'll teach you many ways in which you can start learning how to listen to your body better. Okay, and understand what the body is asking for. Not just trying to think about it logically. You will definitely see a reduction in your cravings, your digestion will be better, bloating will be better, bowel movements will improve, and you will be less puffy and inflamed. In fact, one of my old friends has joined the last batch of the Hormone Reset program. And she was telling me, she just called me 2 days back and she was telling me, you know what, one thing that is happening is everywhere I go, everybody, all my friends, colleagues are asking me, what are you doing? How come you're shrinking like this? Okay. Shrinking as in she has lost only a little bit of weight. It's not that she has lost a huge amount of weight yet, but the inflammation has gone down. Okay. So everybody is noticing that and asking, what are you doing? So this is the program. The next batch starts this weekend, 10th of June, Saturday. That is the group sessions, the live sessions. Okay, any individual can join the program at any point of time, and if they join before the group sessions start, they actually get extra free time in the program. Right, they get more time. The program cost is 14,000 rupees. This includes everything that I mentioned in the previous 2 slides back. Any cost of supplements and testing will be separate from this. Okay. However, right now for the participants of this webinar, we are offering it at a discounted rate, and this is available to you for the next 2 days till the 9th of June. Okay. So that's all from our side in terms of what we wanted to share, and we are open for questions now. Maybe what you can do is you can raise your hand and okay. So before that, I'm sorry, I want to show you a short 2-3 minute video of some of our past participants sharing their experiences with the program. Share sound.
I was trending from double XL to triple XL in my dress size, and I have come back to my double XL, and my knee pain is gone, which was the latest last 6 months biggest issue I had. I couldn't walk, but it is gone. And if I strain too much, it is the feet pain. Small issues are there, but my major pain was the knee pain, which is gone. I hope that if I continue doing this and I succeed in losing more weight, and things can get better. I don't want anybody to face what I've faced in my life. It's very tough being a woman, being what we have to do in our lives. The responsibilities hold, not only physically but emotionally. I think it's great. Continue well, all of you. All the best, and I really hope this works for all of you and you guys get healthy. Before joining the program, I used to feel that life is just going out of my hand. But this program was doing, and the fasting accelerated, I think, the speed of mental and emotional imbalance. And now I feel that, everything is now in my hand. I feel that I can take charge of things. So that was a huge shift throughout the month.
A lot of good changes have happened over the last couple of weeks, starting with my menstrual flow. So I would say that has got better as compared to what it was earlier. I think skin glow has increased a lot. And second thing is that my dark circle has started reducing. I'm very convinced that I would like to follow this diet at least for in the long term.
I was diagnosed with 4 big size of fibroids in around the same time lockdown last year, and due to some extensive exercises and physical workout, 1.5 years I went through hell. I tried everything: Ayurvedic, homeopathy, Siddha medicine, everything. I've tried everything and it just didn't work. I also tried hormone pills for 3 months, and that just thickened my wall and had some complications. So a friend of mine suggested to do this program, and I did this program. I was still going through hell during the program. There were many days in the program my video will be off because I'll be going through so much pain and cramps that I'll be lying down, and I cannot even attend the program properly. The situation was really bad. As I followed the diet that they are suggesting, and medicines and supplements, just the lifestyle, I would say that I was just determined that, okay, fine. I asked doctor how much time it will take for me to heal, So she said about 4 to 6 months. I said, okay, 4 to 6 months, I'm going to devote myself to whatever they are saying. So I went through, and every month it was definitely difficult, but every month it started getting better. Since last month, there is no pain. I mean, I don't know, it's like not less than magic for me. It's bearable, very bearable, I would say. No pain. Yes, bleeding is still there, but it's changing. I would say every month I see something, a drastic change. ऐसा नहीं है कि थोड़ा-थोड़ा change हो रहा है. It's a drastic change. So I don't know, मैं जितना कहूँ उतना कम है, but I'm ready to share how much ever possible I'm willing to do, and I just hope that you take this step and just go through the program.
So yes, we are open for questions now. I've allowed you all to unmute yourself. So one by one, we can answer your questions.
हेलो
Yes, Reena.
हाँ एक्चुअली मुझे ये आपको यूवाइटिस हो रहा है तो डॉक्टर ने मेरा ब्लड टेस्ट वगैरह सब करवाया है हेलो हाँ
Okay.
ब्लड टेस्ट वगैरह कराया सिर्फ उसमें कोलेस्ट्रॉल जो है वो उस पे आ रहा है बॉर्डर लाइन पे और विटामिन डी पर वो यूवाइटिस का रीजन मतलब वो पता नहीं कर पा रहे पर बॉडी में कहीं पे इन्फ्लामेशन की वजह से उसका वो इफेक्ट आ रहा है तो वो मतलब आपके यहाँ से कैसे मतलब रहेगा
Uveitis is also connected with autoimmunity.
yes exactly yes
Yes. So as we have been answering many questions in the chat about autoimmunity also, there will be different external expression of the disease. आँख को असर किया तो हम उसको यूवाइटिस बोल रहे हैं, थायराइड को किया तो हाशिमोटोस हो गया, इंटेस्टाइन को किया तो क्रॉन्स डिजीज हो गया, right? So where it expresses or where it shows up might be different, but the root causes do not change too much, right? So definitely we can help. We can definitely help.
ओके सर मतलब सर इसमें क्या बताया है कि सीरम एसीई कुछ होता है जिसमें उसकी वजह से उसमें इन्फ्लेमेशन दिखा रहा है बॉडी में एसीई सीरम कुछ
Correct. That is only a marker कि inflammation है.
yes.
It's not telling you क्यों है. That's what we have been discussing for the last 1 hour.
Right sir.
Yeah.
तो सर मतलब मुझे ये ज्वाइन करना रहेगा सही रहेगा ना मतलब आई एम ऑन द राइट वे ना
100%.
हाँ सर तो आई एम वेरी मच लाइक इन इंटरेस्टेड टू डू तो आप मुझे एक कॉल मतलब प्रोवाइड कर सकेंगे सर आफ्टर योर सेशन
So
You can
Reena,
do
our
that.
team will connect. Yeah,
Yes,
our team will connect with you tomorrow.
Sure, madam. Sure. तो एक दो मतलब मेरे पास yes. So where should I give my number, madam?
In the chat, you can leave your number.
Right. Okay, ma'am. Then I will connect you. Yes, ma'am. Thank you so much, ma'am.
Sure. Everyone else, before we take up more questions, there's a poll that you can see on your screen. Please answer the poll. That will help us connect with you if you need, if you want to enroll for the program, if you have any queries, please answer the poll so that our team can connect with you tomorrow. Thank you. Okay. You can raise your hands if you have any questions. Others? Anybody who has questions? Okay, we'll take up questions from the chat. So Nusrata, what's your question? Nusrat, what's your question about myositis? So myositis is inflammation of the muscles, right? Now, Nusrat is asking about myositis. Vijay, you asking about urticaria, dry mouth, dry eyes. Okay, so both of these, whether it's myositis or whether it's dry mouth, dry eyes, are autoimmune condition, right? So to be very specific, Vijay, dry mouth, dry eyes, it comes under the condition called Sjogren syndrome, right? Where the mucous membranes are affected by autoimmunity and hence they do not produce enough lubrication and the person starts experiencing dry eyes, dry mouth. Urticaria is again what do you call it? A hyperreactive immune system, right? Your immune system is just on fire and it's responding to every trigger. So it needs to be brought back to balance. So there are triggers for it and the triggers need to be identified, and if we address that, it can be brought back to normal. And the same for Nusrat, myositis is just like how Reena was asking about uveitis. Myositis is inflammation of the muscles, right? As a result of which you start experiencing chronic fatigue, pain, and various other symptoms, weakness, right? And infections are at play, heavy metals, poor mitochondrial function is one of the main reasons. So if we address this, recovery can happen.
Hello, ma'am. My name is Pavitra. Can I have a doubt, ma'am?
Sure.
Ma'am, actually, like past from 6 months, I've been experiencing gut issues. But past from 15 to 20 years, I'm a PCOD patient. But recently, from past 6 months, I have intestinal issues. Like previously, I had constant diarrhea as well as difficulty in digestion. But recently I joined Herbalife products, things, ma'am, like protein shakes that I've been using from 1 month. So my diarrhea issues has been solved, but I don't know the side effects about of these. But still, inflammation part I have joint pain as well as pricky pain in my stomach as well, still there. So can I get suggestion regarding this, ma'am? Hello, am I audible, ma'am?
I'm sorry, can you briefly repeat your question? Your voice wasn't
Sir,
very clear.
Oh, okay. Sir, from past 6 months, I was experiencing intestinal issues. So when I
Okay.
got my colonoscopy done past 2 months back, I got a mild proctitis was identified.
Okay. It's a
Then,
little polyp kind of growth, right?
but there was no polyp kind, but only a inflammation was there. Very redness was found, that's all.
Okay.
But when I got the biopsy done, there is no specific inflammation found. It was the report, but then a doctor suggested that you is to avoid some gluten-free food and add in leafy vegetables and green leaves, all those things, and non-veg has to be completely avoided. With the coffee, tea, or beverages has to be avoided. I was following that since there was no solution, but then I joined a Herbalife this one, sir. So will it really help me? But then I found some improvement in my loose stools. My loose stools stopped, and then some part of pain also reduced. So will it really help me out in getting rid of this solution, or should I stop taking it? Will it be a problematic if I go in long term?
No, I mean, if you're taking good quality supplements, that should not be an issue, but you have to keep track of the levels. So let's say you're taking vitamin B12, you must keep track of the level, at least check once in a while, once in a few months to see how much, you should not overdo also. But then supplements are not necessarily a complete solution, okay? You have to look at why this happened, what are the reasons, and start addressing those as well.
Okay. Supplements in the sense I've been using protein shakes that will be provided by them from morning and evening. Is it really dangerous or will it be helpful? Should I stop immediately?
Protein shake, if it is good quality, that should not be an issue. You can take it.
Okay. Okay, sir. So I think that will be a solution for me, sir. Because I'm pain still persists, but
that's what I'm
it's not a
saying.
solution.
That will not be a solution. It will help you feel better, but that's not going to be a complete solution.
Okay. Yeah. Fine, sir. So to enroll this course, you mean 14,500 has to be paid?
14,000, but right now, if you do in the next 2 days, it is 13,000.
Okay, sir. Thank you for answering my query.
Yeah.
Hello. Hi, I have a question. May I ask you?
Yes, please.
Yeah. So I suffer from acid reflux issues, right? So I have been diagnosed with GERD. So I want to understand, like, so far with my discussions with doctors, what I've understood, it's basically because of a dysfunction of the ADS, right? So why people get GERD, right? But is there a link? How can we cure it by like curing the dysbiosis or other stuff also? Is there a link to this as well?
Yes, of course. So there are many things. See, LES, one has to ask the question, why is the LES not functioning properly? There could be infections there, okay? There could be deficiencies. For example, if you're deficient in magnesium, the valve may not function properly. Okay, there could be food sensitivities. If you're sensitive to certain foods, because of that also you can have GERD or acid reflux. So there are many reasons, and you have to look at those, find out what those reasons are, and start addressing those. Just saying LEs is not functioning properly is not a solution.
Okay. Is there a link with gut microbiome also with GERD? Or...
That's what I said. There could be an infection in the stomach in that region. Yeah, it can create that.
So this program can help me with this as well, acid reflux?
Absolutely. Yeah, oh yes. It's a very common problem actually, and we've been able to address it very, very effectively.
Okay. Thank you.
Yes, Ratnam, you've raised your hand.
हेलो हाँ सर मेरा क्वेश्चन था कि प्रेगनेंसी में मुझे थायराइड डिटेक्ट हुआ था तब से लेके अब तक मैं थायराइड पिल ले रही हूँ सुबह 75 माइक्रो mg तो ये कम्प्लीटली रिवर्स मतलब बिना पिल के हो सकता है और कितना टाइम लगेगा
I will say complete reversal if you stay focused for that period of time takes 6 to 9 months.
6 to 9 months.
6 months, yes.
अच्छा क्योंकि हम FMC का डाइट फॉलो करें मेरा बेटा दूसरे प्रोग्राम के एनरोल है तो उसके चक्कर में हम पूरी फैमिली 6 महीने से उसी डाइट पे है जो स्ट्रक्चर वाटर या बाकी की चीजें बोले वो सब कर रहे हैं तो उससे थोड़ा फर्क पड़ेगा ना
Definitely, that will also help.
Okay.
So some people were not able to see the poll. Please check if you can see it now.
तो आपने जो 1000 मतलब अब तक हुए हैं तो उनमें से थायराइड के केसेस कितने थे वो कितने सक्सेसफुल हुए
Number तो नहीं है but thyroid is a pretty common problem and especially for women. We have a very good success rate with thyroid, including Hashimoto's, which is autoimmune thyroiditis.
Okay. ठीक है. Thank you.
Welcome.
Okay, so if there are no more questions, then yeah, I think we will wrap up the session. If anybody still wants to answer the poll, please do. And thank you all of you for being with us for the last 1.5 hours. If any one of you wants to join the program, you can reach out, you can drop your number here. Our team will connect with you. You're all, and if you're not a part of the community yet, please join our community. It's only a broadcast group, so you'll receive the updates from us. So thank you, all of you, and we look forward to assisting all of you in your health journey. Thank you.
Thank you. Bye-bye, everyone.